A group of Americans feel that our healthcare system is in shambles, and in order to fix the system, we must change the way Americans access care. Most liberals feel that there should be some type of universal system or mandate for all Americans to have insurance. There are two main reasons for health reform: to make people healthier and to lower costs. Conservatives feel that government spending on healthcare is irresponsible because it will not improve our system and it will deepen the economic recession. However, without a change in our current system, people will continue to avoid doctors and increase healthcare costs. It is absolutely necessary to improve our healthcare system by increasing the access points and decreasing the cost to the American public. Those opposed to health reform say that government will be rationing healthcare for the American population. For instance, an anonymous opposer stated that nationalized healthcare puts bureaucrats, not doctors, in charge of deciding who needs what medical treatment. This is an illegitimate claim because national healthcare reform would offer a way to get insurance that already exists or offer a new plan that people can afford. According to President Obama, people can keep their insurance if they like it, take part in the public option. Insurance companies cannot place caps on coverage, and insurance companies must provide preventative care. Hardly sounds like the government is rationing. In fact, the government is making sure care is complete, without any holes in care, to make sure that everyone gets what they need. Accomplishing health care reform will lower costs and keep people healthier. Jan Grover reported that people with chronic conditions such as asthma or diabetes would benefit physically and financially. For instance, an asthmatic who cannot afford primary care or medication would become sicker and sicker if their symptoms were not treated. Eventually, they would have an asthma attack and end up in the emergency room. According to the Florida Agency for Healthcare Administration, the average cost of this visit, over $1,000. Since the family cannot afford this, the hospital has to cover the cost. With a health care plan, the patients would be able to see a primary care physician and get a prescription for the condition. What this means is that the patient is healthier and it costs just a few dollars for the prescription instead of a visit to the emergency room. President Obama said nearly half a century after Teddy Roosevelt first called for reform, the cost of our health care has weighed down on the economy and the conscience of our nation long enough. So let there be no doubt, health care reform cannot wait, it must not wait, and it will not wait another year. By decreasing healthcare costs and increasing accessibility for Americans, Americans will become stronger, healthcare will become more proliferated, and our economy will become strong again.